know your area of expertise, speak to your area of expertise, and defend it when you know the material. But at the same time, be careful stepping out of that. I'm not going to do a literature review on the treatment of diabetes and go try to, educate people on diabetes using doctor in front of my name. That's not my area of specialty, right? And so that doctor title still carries you. And I think a lot of times people on social media, you'll see it where they'll use doctor and all of these initials. And keep in mind that patients or other providers might not know the relevance of those things.
All right. Well, welcome to the show, Damian Keeter. We are so glad to have you with us today on our AOMPT Hands-On, Hands-Off podcast. Thank you for joining us, first and foremost. We appreciate it. I would like to go ahead and just welcome our audience to our show today. And today we're diving into a topic about how we engage with our patients, our colleagues, and the broader healthcare community through social media. So today our guest is Damian Keeter, who has not only leveraged social media platforms for professional growth, but has also studied it in terms of better understanding its impact. And so Damian is a clinician researcher. He's a dad. He's an active outdoorsman. I think he likes hunting. And he's a fellow Ohioan, which I have a special place in my heart for. So that is awesome. And he's actively engaged in OMPT research, which is why we are so excited to have him on the show with us today. So maybe you have read or listened to some of his work. So specifically in our today's episode, we want to explore the upside and the challenges of social media in our field and how it can be a tool for connection, education, and advocacy, but maybe there's a little bit of ethical boundaries that we also need to explore so we don't cross lines. From success stories to potential pitfalls and valuable lessons along the way, Damian has some great insights that he's going to share with us today. So without further ado, let's jump in. Welcome, Damian. We're glad you're here.
Thank you, Megan. Thank you for having me. I'm very excited to be here. I do have to give a little disclosure as I am a federal employee that my opinions today are my own. They do not represent those of the United States government or the Department of Veteran Affairs. So now that we got that out of the way, I'm really looking forward to this talk.
Well, you're the guy. So I wanted to have this conversation because when I was coming into this president role of AOMPT, I won right before I won the Manella Award. We've really needed to be challenged about how do we engage in social media. And so I've been diving in, and I saw that you published an article in 2023, which was Credible or Questionable: Assessing Quality of Evidence on Social Media. And so you state this in the social media platforms that they can open the door for misinformation that challenges evidence-based practice and that can potentially influence patient care. So I would love to dive into this a little further. I mean, I think we'll probably hit different tangents and facets of the conversation, but I can't wait to kind of hear your experience with this. And maybe where did you start to find a passion to study topic of social media as it influences practitioners, especially in healthcare?
Yeah, absolutely. Thank you. And it's been a passion of mine since I think I was in an interesting generation because I technically am a millennial. I'm on the far end of millennials, but because of that, I got to kind of see both sides of the coin. And what I mean by that is, I remember the time before that connection, before cell phones, just connecting you to everything instantly. And then I saw the transition towards that. So, I remember when Facebook first came out, and I remember before it and then after it. And so, I got to kind of see how things changed in real time, rather than, and I was in the generations using those things. A lot of these individuals using these things in, college and stuff like that when they came out. So it was a really interesting thing to see the transition of it. But with that, I got to really see some of these huge benefits that are just awesome, as well as we know some significant challenges in that domain. And so for me, I think that's really what sparked the interest in it. Moving beyond that, we've really got to discuss this a lot in our residency program here at the VA, talking about how learners, they don't learn the same way they used to. And as we progress the way we teach things, we have to appreciate the different understanding and leverage of some of these social media platforms for learning and things like that. And I think as I've seen that in our classes of residents and even students coming through the clinic, it really has emphasized to me, yes, this is something that's interesting, but it's also very important for us to jump on board and make sure we utilize this stuff and understand this stuff for the future learners, for the future PTs.
Absolutely. So analog youth, digital adulthood. So you're not a dinosaur. You have an appreciation for both sides, which is great. I resonate with that. So just so people know that I am not a millennial, close but not. And so I appreciate that. I think that that gives you a really unique perspective that you can appreciate where students are nowadays with all the information and the processing and digesting. But you will have a different kind of awareness to it because you didn't really grow up during that time where they were having all of those challenges, how much to process, right? So now we're in this, I would say, this different age, right? So not only do you have so much to process, but you have to check the stories. You have to credit check. We have to figure out what is truthful versus maybe self-promotion, and I think the old words used to be gurus, right? Like somebody just had a facet or a style that they promoted, but it wasn't really always evidence-based. And I certainly can see that even occurring in a social media, but with a larger audience now between YouTube and some of the social media platforms such as Facebook, Instagram. I mean, there's all different types. I mean, we can get into the even younger days now, how some of those individuals are connecting. But I would love to hear some of your positive experiences that you've experienced maybe or heard through social media in our community, healthcare, physical therapy, or specific to OMPT. And then we'll talk about some pitfalls. But let's focus. What have been the positives that you have seen when using social media?
Yeah, thank you, Megan. I think there's a lot there. I mean, you see it every day. If you're active on social media, you see this collaboration and reach every single day. To me, that's really the biggest benefit of social media overall, is this idea that you're able to get information to and from far reaches of the the publications and all those things. There's so many journals that are publishing relevant information to us. There's no way as a researcher you're able to keep up with all that stuff. But if you find some other researchers that follow similar interests to you, you have other people siphoning through some of that and feeding some of that to you. And so it's really beneficial to see some of this information. Furthermore, though, like I said, that collaboration, really being able to not only read an article, but ask questions about it, or talk directly with the author about this. These aren't things you could do 20, 30 years ago. I mean, even in the time of, yes, we had email, yes, there were corresponding authors listed on emails. A lot of times people didn't want to ask them simple questions. You didn't want to just ask them, hey, what are your thoughts on this? Those were things that you're comfortable asking in kind of an informal social media question, but it's not something you would write an email to, a world-renowned researcher on typically. And so I think it really opens the door for this connection with the authors, which is great. And my personal experience with this, I have a good example of this that actually occurred with me earlier this year. Is I saw on Twitter, now X, formerly Twitter, I should say, saw on X that Nathan Hutting posted a little thing that he was coming to the Ohio State Conference. Now, I had no intention of going to the Ohio State Conference at the time because I just had too much stuff going on, and it was right around my birthday. But regardless, I saw that he was coming to Ohio, and I said, this guy's a big deal. I love his work. Why is he coming to Ohio? No one goes to Ohio, right? but I said, he's coming to Ohio. So I reached out to Ken Learman, another Ohioan, a fellow Ohioan, and I said, Ken, get in the car. We're going to Columbus. We're going to go to this conference. And we ended up going to this conference in Columbus, Ohio, which we actually ran into yours truly, Megan Devils, at that conference. And we went to, we went just for Nathan's talk. And it was really interesting because we went in the morning, we're sitting there eating breakfast, and I had seen his pictures, again, only because of social media. There's Nathan standing over in the corner, just eating breakfast, kind of hanging out, looking around. And so I went over there, I said, are you Nathan? And he's like, yeah. And so we got to chatting. And it was great because we ended up going to his talk. We ended up having lunch with him. And then this led to the idea of, hey, we should write a paper together. And then we did. We collaborated. We wrote one paper together, which has been published in JOSPT Open on person-centered manual therapy. And we actually have another one in peer review on social media. And so it's really, this collaboration would have never happened if it wasn't for that social media, me seeing that he happened to be presenting at the state conference. And the funny thing about that is when I asked him why he was at the Ohio State Conference, he just said, I don't know, it seemed like Ohio was a cool place to check out. You had no other reason to be in
Ohio is a cool place to check out. That's right. Then
it is.
Oh, that's great. Well, and I appreciate that, and I think what's nice now is like on social media, you can follow people and again, it hits your feed, right? You have the opportunity to not have to work hard to keep up if you want to follow researchers or see what they share, right? So again, infographics, those didn't exist years ago, widely shared now, that helps you to really translate what you're seeing in research, how it translates to practice. And so much of this is good information sharing when done well. And I think that that's what you're expressing, is you get to touch base with researchers who are living that. And I would even say clinicians who are really, presenting and doing the things that highlight the hard work and growth that they have built as a professional. And what a unique way to collaborate and then connect even in person. So hybrid is one of my favorite conversations for another day, but in person and then virtual, and then it comes together in a really great collaboration. So what a great positive success story for good use of that. So now I want to change directions a little bit. And I certainly think you could probably speak to this as well. But what are some of the challenges or common pitfalls that you or others have faced while navigating social media in this space? Maybe as a researcher, highly recognized, or maybe just as a clinician navigating it?
Yeah, this is a challenging topic, because I think that there's, the common term that always comes up is misinformation, right? Misinformation, disinformation. I think we all know that there's a lot of stuff out there that's just total and utter BS, right? We know that there's a lot of stuff out there that's just not accurate. The challenge isn't even from this information just being out there. Yes, that's a problem, right? But we know that, that's something that can be addressed. The challenge comes from all the stuff that surrounds the misinformation to me. And one of these things is the way that it's often presented, right? A lot of times this misinformation comes from sources that have a lot of time to designate to this, okay? I'm a full-time clinician. All my research is on my own time. Everyone in this area of study, or that's highly involved in OMPT, has a lot of things they're involved in, whether it's teaching, research. They have all of these really important things where typically social media is kind of a side thing they do when they log in when they can, where when you see a lot of these individuals that are posting just utter BS, the real misinformation stuff that we all can look at and say this is misinformation, they're individuals where this is their thing. They don't have all of these other things they're doing to occupy their time. They have a lot of time to invest into this. And it's a really unfortunate for people like us, because we log in, to some of these social media platforms a couple times a day, maybe for short periods of time while we're doing something else. Whereas these individuals might be sitting in front of that computer screen all day. And with that, it makes it challenging because they're firing this stuff nonstop. And they're able to continue to just try to support their own thoughts and beliefs and some of these biases, and it makes it really challenging. On top of that, there's the way that they're able to communicate, right? I work for the United States government. Most people that work in different OMPT settings work for high-level institutions or different academic institutions. They can't go on social media and just curse and discuss things in an inappropriate way. And so they have to be careful about how they're presenting this information. Right. And that's a challenge when you have individuals who might not have those same, handcuffs to them, that might be able to just speak more freely on things and get a little bit more aggressive with things. And so it's really challenging because you see some of these individuals that present this very typical narcissistic type of communication. And they've done a couple studies on this to show that they present this, a lot of times this social media personalities present this narcissistic type of, information and way of communicating on things that people in professional academic settings won't put up with. They'll just remove themselves from that. So now we're in a situation where we have these individuals who are posting this misinformation, who are presenting more of it because they have the time, and in presenting it in more aggressive ways because they don't have these same kind of ethical constraints limiting what they're able to say. And so it floods things a bit. And so it really does make things challenging for us as, consumers of that information to kind of siphon through.
Absolutely. And it becomes polarizing, right? Do you engage in that? Do you give feedback back to, that individual? And most likely not at times, right? Unfortunately, that's usually when people withdraw. And so then the individuals have even bigger platform because there's no pushback. And so we have seen this, right? And I would say, I mean, for those who are listening, manual therapy has swung the pendulum over a short period of time, whether you use it or don't use it. And I think you can see this as a testimony to some of the social media platforms and big, individuals who feel like that's a platform that they want to speak towards. And so I hear some of the challenges, but definitely the misinformation or disinformation is something that I believe our next generation of practitioners have to navigate through, because it makes it really hard to know what's truthful, right? I mean, we see this in our TVs every night. What's truthful, what's not? And it's so hard to kind of navigate that balance, especially a younger version of yourself who's just now coming into the PT profession, trying to digest as much as you can so you can give your best patient care. Navigating it is really hard. So I appreciate that. It's hard. It's so hard. So that takes me to our next spot where I wanted to ask you, with all of the amount of information that's online, how do you suggest that OMPT practitioners, those who are listening in our audience, stay evidence-based and try to avoid some of this misinformation that we're talking about?
Yeah, thank you for that, because I think that's important. We're going to get this information. It's how do you kind of siphon through this? And I think one of the things I really like to have some of our residents and some young learners reflect on for everything, but including the social media stuff, is why do they feel that way? What is the other side of this, right? We all see things through our own personal biases, which is okay. You can't get rid of those, right? But it's important when you look at these things to say, why do you think that this person sees things this way? So you can see maybe some of the rationale they have behind some of these things. And it's really interesting because a lot of times when you do that, you're able to dive into some of their tactics and things along those lines just by assessing that kind of other side of the coin. Yes, this is how I see things. I see this as total BS. They're presenting this way, but why? What is the rationale behind that? And I think a lot of times you can get that by looking at the source itself, and that's why I wrote that JOSBT blog you were talking about, that credible or questionable. That's where that came from. Is looking at this, assessing the source this is coming from. And one of the things I did for that is put together this little algorithm, which was kind of comical, but it's this idea of, you get this information presented to you. You have to establish where this is coming from. Now, is this person a content expert, right? Because if this is just an article that's presented to you and somebody says, interesting read, and puts it on social media, right? They're opening it up for your interpretation. That's great. Okay, I would say at that point, they're still allowing you to assess that evidence at its level of evidence based on the study design, right? As soon as that person puts a twist on that or a spin on that, saying this article is total BS because it doesn't agree with blah, 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 or they did this the wrong way because A, B, C, D, right? As soon as they provide that twist on that, that regresses that a bit to expert opinion, okay? Mm-hmm. And even then, we have to ask ourselves, is this person an expert? Because anyone who's published knows you have an editor and a couple peer reviewers who are looking at your study before they're published who are actual experts. So you have people who are very, very qualified, who have already looked at these studies in most cases, to review them to make sure it is, done in an appropriate way. And so then you get to a point of an expert, or maybe it is a real expert, offering the opinion. Then you have to assess, does this person have any conflict of interest, right? We, as authors, we have to disclose that. When I submit a paper, big disclosure. Are there any conflicts of interest? Are you making any money by this opinion you're presenting? Mm-hmm. That's not present in social media. And so it makes things challenging, right? Because you have individuals that is their livelihood, right? You have to ask yourself, is this person, relevant, and that's why people follow them on social media? Or is this person only relevant because of their social media? And unfortunately, we have a lot of these folks that are only relevant in the profession because of what these personalities they've created on social media. And so you take this, and if you say this person maybe is selling courses, is selling products, and a lot of times it's obvious. You'll see this doesn't agree with, A, B, C, D. OMPT is not evidence-based. There's no reason you should receive training in it. By the way, here are some courses I'm doing. Follow me on Instagram, follow me on Twitter, right? And so it's usually followed up with something that leads to direct financial gain. Okay, but they don't have to disclose that. But a lot of times you're able to work through and kind of see that, see that conflicts of interest that they have. On top of that, really diving into the references. And that's what I really like to promote, individuals going on social media. Yes, if somebody shares this article, you can glance at their opinion, but read that article yourself. It's like abstracts in studies. They've done reviews on this, right? And what have we found is that individuals are able to spin abstracts even to make them sound like what supports their beliefs. And so do you think people on social media can do similar things by spinning their idea of what the results show? Yeah. So read it yourself, pull it up, look at it, send an email or a message to the author if you have questions. Don't just listen to somebody else's opinion on it.
Well, and I love the algorithm in your paper. So I will say I'm a little bit of a geek, self-proclaimed. So you can say it back to me and it's totally okay. But I really appreciate the way that this article kind of breaks that down. And I think, I always think about flowcharts. I like structure, so that's not lost on people who know me. But I like a way that helps somebody navigate through a lot of information, and a process helps. And I think that algorithm is really helpful where, I would say a flow chart, right? It's guiding you through, asking you to ask yourself questions, a reflective opportunity to say, where is the information coming from? How do they gain and benefit from it? And, when you're stepping back, what ways can you either prove or validate that information? And again, I think you're spot on, having opportunities in really positive ways, like having you on this show and having some of our podcasts. We hope to be able to highlight that these individuals not only write it, they believe it, but then they show the research, right, about what they're doing and how they're furthering study. And I love the fact that we start with questions, not with a bias. We start with questions, and it's often we undo our bias, right? Like, oh, I didn't know that was going to happen. That's the best part about some of the research that's come out. So again, I appreciate kind of your thoughts to driving our new clinicians in a way to kind of handle some of the misinformation and definitely the vast amount of information that's out there. So that is awesome. So I'm going to change gears again. And instead of talking about clinicians, I want to talk about how can we start to connect our community and our patients. So we were talking about having students navigate this, but what about patients who are just starting to they have no contacts? They don't have this resource that lets you dive in and navigate it in the same way. So what learned lessons do you have there from using social media to connect with health professionals in the community outside of our own scope? And then what about patients?
Yeah, I think assessment of health literacy is very important. Obviously, you get these individuals, whether it's different health professions or individuals at different different levels of education as far as patients go, and they're all at different levels. And so I like sharing information with these individuals, but it makes it very challenging because we know that when it comes to concepts like pain neuroscience education, some of these things, it needs to be catered for the individual in front of you. And so that's one of the big challenges in social media, is a lot of times it's catered for the average. And I think a good example of this is how this information can be presented in a way that's really not optimal for us. I'm assuming a lot of individuals have seen how Stuart McGill did a recent Huberman podcast, and I love Stuart's work, and I think he's done some great things for our profession. But a lot of his concepts are a bit outdated from what we understand about low back pain specifically. Okay, and I think we all saw that, and in this large geared largely at patients, this large podcast type of thing he did, and it really highlighted some of the things you don't want to do, which you don't want to present things in a way that creates any type of nocebo-based, fear of movement, and this idea of anatomical, pathological, terrible things causing these pain complaints, and all of these things that are just outdated models. And it on the counter side of things, Peter O'Sullivan did a recent podcast on the same exact topic, which was the polar opposite, which was really geared towards what we do understand about pain, what we do understand about how you treat it and how you manage it in these things. Again, geared towards a little bit towards patients as well as towards clinicians, but in a way that really highlights the variability in it. And it's not that something's out of place, or not that this muscle's weak, or because that's, maybe for one individual patient that might be a problem, right? But to paint that across every patient, it's a huge challenge. And so I think that's, from educating patient standpoint, I think that's the challenge, is how do I educate these individuals individually, in a way that's beneficial to them based on their specific needs. And so to be honest with you, I don't use social media as much for patient type of, information or education for that reason, is because I think it's from a person-centered care standpoint, how do you make it individualized?
Right.
And so I don't do that as much, but I think it's important. I haven't gotten involved in that realm of things.
Well, and it's super tricky. And I can tell you that even with your website, you have to be so thoughtful about what words you're putting out there and how you're leading people and what you're linking them to. But even just keeping them up to date, it makes it really difficult. So I continue to challenge people to think about, if an end in mind is patient-centered care, what resources are we providing to that end body, that end group, and really being strategic about the way we interact with them throughout these social media platforms in thoughtful, intentional ways without trying to steer them or misguide them. It really should be what is in the best intention, which is to hopefully get them to the right care, right? And get them the best outcome. So, I think people always have two sides, just like you said, Stuart McGill, and then you turn around and you think Peter O'Sullivan, but those are two different philosophical approaches. Maybe one's right, maybe one's wrong. Maybe both are right, maybe both are wrong. I don't know that we know, but we certainly can at least explore philosophies, and they're not out there trying to get that self-gain. They are seeking and researching and doing some of this work, and you certainly can connect with those individuals to talk with them about their studies and the work they're doing, right? So I think the other piece is, and you kind of hit this a little bit, but, these individuals that you were just speaking about in the Huberman Lab is definitely a healthcare professional who, he has a personal brand. I mean, they have a personal brand. And so how do you, as a healthcare provider, use social media, build transparency and integrity while you're still trying to promote what you're doing? I think this is a tricky space. And, what advice would you give to other professionals trying to navigate it?
Yeah, I think first and foremost, know your worth, and know your value. And I think that a lot of times we take for granted how much patients, and other people listen to us. And so, especially, what does the term doctor mean to people, right? And my wife likes to remind me frequently, after I have 2 doctorate degrees, likes to remind me frequently that Dr. Seuss is also a doctor. And so, but at the end of the day, if you have doctor in front of your name on a social media platform or something along those lines, keep in mind, patients aren't able to decide, or other people may not be able to decide what your doctorate is in or what area you've studied. So know your area of expertise, speak to your area of expertise, and defend it when you know the material. But at the same time, be careful stepping out of that. Okay, because you reading, I'm not going to do a literature review on the treatment of diabetes and go try to, educate people on diabetes using doctor in front of my name tomorrow. That's not my area of specialty. I haven't done research there. I haven't done anything there, right? And so that doctor title still carries you. And I think a lot of times people on social media, you'll see it where they'll use doctor and all of these initials. And keep in mind that patients or other providers might not know the relevance of those things. They might see the whole, ABC soup there and think that this person is an expert in everything. This is a person that might, should be giving me advice on what vitamins to take, when that individual might have no training in that area of expertise. And so I think knowing your value, both the positives, what you do have to offer, and the negatives, the areas that you probably shouldn't be speaking to. Right. And I think that's really an important thing to keep in mind. The other thing is following ethical standards. Again, we don't have conflicts of interest in social media. I don't have to sit there and tell people, oh, by the way, I'm making money off of this. But simply put, you should do what's right. Right. You should do what's right because you know that it's not right to try to trick people and give them bad information, right? If we know that manual therapy is shown to lead to improved downstream, outcomes, decreased healthcare costs, decreased opiate utilization downstream, all of these things, and you're sitting here saying, you shouldn't use manual therapy, no one should be trained in it, you shouldn't educate, you providing that information are going to negatively impact patients down the road because of that trickle down effect of what you're telling some of these providers. So you have to do the right thing and think about, is this information that I'm providing really the best we know, really what's best for these providers to hear and for their patients to, downstream to be influenced by, or are they what's best for me and my own financial well-being and perhaps patting myself on my back for my own biases? And so, I think really appreciating that is important. Providing your sources, making sure you give people the ability to look things up themselves. Again, give them that opportunity. Don't try to tell people how they should feel about things. Okay? Give them the opportunity to say, this is an article, interesting read. Here's my thoughts on it. Let me know what you think, right? Open that door for them to dive deeper into some of this stuff. Don't be afraid to admit when you're wrong. One of the things I love telling people is challenge your biases. We all have them. You cannot make them go away. Be aware of them, become friends with them, and challenge them. Okay, if you find a paper that doesn't agree with what you think, look at it and say, what did they do here? And is it them that did something wrong in this study that I don't agree with? Or do I need to change the way I'm looking at this? Because again, there's different opinions on things. Just like you were saying, Megan, there's this idea of, it's just different philosophies looking at things oftentimes. And so oftentimes it's not a right and wrong. It's just different sides of the coin looking at things in a different way. And then opening your mind to things outside your comfort zone. Being able to dive into some of this stuff and just learn a little bit every day. I always tell, I always tell our residents, I say every day, we're either getting a little bit smarter or a little bit stupider. So you have to learn some new stuff. You have to open your mind to say, I don't just want to keep reinforcing what I already know. I actually want to learn some new stuff. I want to dive into some new stuff and, investigate some other people's thoughts on these things.
Well, and I think what you allude to in that is that research is hard. I think research is so hard. And, when you see different philosophies, people may not be bantering about somebody else's approach, but rather maybe they had a different subset of patients in that experience. Maybe they had more females, maybe they had more males, maybe had a different ethnicity, maybe they have a higher chronicity. I mean, there's so many variables that go into research that I feel like that's why it gives it more merit rather than it being a myopic singular approach. It allows you to kind of think a little bit more open and broad. And I love that. I've also seen in Twitter, which you can, X, is that you see somebody will say that, and then they'll do a thread with another link or resource and another link or resource. I love seeing that because it kind of keeps you as a follower or reader. Like, I'm hearing what they're saying, and then they provide me another link or resource to kind of go to, because X is limited by characters, right? You can't put all your information in there. So it certainly is a way of a good tactic, I would say, to try to make sure that you're being as transparent as possible. I found that to be really helpful as a user. I am not as on predominantly on X, but certainly I like to follow a few people. So I hear you there. That's great. Well, is there any other advice you have as we wrap up the show? If not, I'll go ahead and kick us into some closing.
No, I mean, I just thank you for having me on. We are actually doing a talk. You, me, and Chad Cook are doing a talk on this topic at AMP. So anyone at the conference, please come see us. We did a really interesting narrative review on social media content related to musculoskeletal rehab, and so it's currently in peer review. We're really excited for the results of it. We're looking forward to discussing some of those with you guys at AMP. So otherwise, thank you for having me.
Oh, Damien, always a pleasure. And sincerely, we can't wait to have you at conference and can't wait to see all of our listeners who are able to go too. And, this pretty much wraps us up in our insightful conversation of social media. And I have to say thank you, Damien, for sharing your expertise with us, your wisdom, and how we navigate social media, especially as OMPT practitioners, thinking about the variety of audiences that we need to. And although we know it offers tremendous opportunity, engagement, growth, and communication, it's so important to approach it with care, transparency, and that solid ethical foundation, like you were mentioning. So I hope for those listeners, I hope this episode is giving you some food for thought, how to use social media effectively and responsibly in their professional journey, especially maybe as younger clinicians. Don't forget to follow AOMPT on our social media channels. Of course, I have to say that because obviously they're listening to a podcast. So we hope that you'll find that we're bringing fresh ideas, that we're going to challenge our assumptions, and always try to move AOMPT forward in the right direction to do the right thing for our patients. So thank you, Damien, for your time. And as our audience, we'll see you later on the next Hands On, Hands Off.